What is HbA1c? Hemoglobin A1c, HbA1c, is a laboratory test that measures the average blood glucose levels over the past 2 to 3 months. HbA1c is a valuable tool in managing diabetes, as it provides a better picture of long-term glucose control than a single blood glucose measurement. The American Diabetes Association (ADA) recommends that people with diabetes have their HbA1c levels checked at least twice a year. HbA1c is a variant of hemoglobin, which is the protein in red blood cells that carries oxygen from the lungs to the body's tissues. Hemoglobin A1c is formed when glucose in the blood binds to hemoglobin in red blood cells. The higher the blood glucose levels, the more glucose will bind to hemoglobin, resulting in higher levels of HbA1c. HbA1c is measured as a percentage of the total hemoglobin in the blood. In people without diabetes, HbA1c levels are typically below 5.7%. The AID recommends that people with diabetes aim to keep their HbA1c levels below 7%. However, individual goals may vary depending on a person's age, overall health, and other factors. The HbA1c test does not require fasting and can be performed at any time of day. The test is typically done using a blood sample taken from a vein in the arm. Results are usually available within a few days. HbA1c is a valuable tool in diabetes management for several reasons. Firstly, it provides a measure of long-term glucose control, which is important because blood glucose levels can fluctuate throughout the day and can be influenced by factors such as food intake, physical activity, and stress. Secondly, HbA1c provides an indication of the effectiveness of diabetes treatment over time. If a person's HbA1c levels are consistently high, it may be an indication that their current treatment plan needs to be adjusted. Conversely, if a person's HbA1c levels are consistently within their target range, it is an indication that their treatment plan is working well. In addition to monitoring diabetes, HbA1c may also be used to diagnose diabetes. The AID recommends that an HbA1c level of 6.5% or higher be used as a diagnostic criterion for diabetes. However, the test should be confirmed with a second measurement on a different day. There are several factors that can affect HbA1c levels. One of the most significant factors is blood glucose levels. As mentioned earlier, higher blood glucose levels lead to higher levels of HbA1c. Other factors that can affect HbA1c levels include anemia, which can result in falsely low HbA1c levels, and certain medications, such as high-dose aspirin and vitamin C, which can result in falsely high HbA1c levels. It is important to note that HbA1c is just one tool in managing diabetes, and should not be relied on exclusively. Other important aspects of diabetes management include monitoring blood glucose levels regularly, following a healthy diet, engaging in regular physical activity, taking medications as prescribed, and working with a healthcare provider to develop an individualized treatment plan. In conclusion, HbA1c is a laboratory test that measures the average blood glucose levels over the past 2 to 3 months. It is a valuable tool in diabetes management, as it provides a measure of long-term glucose control and an indication of the effectiveness of diabetes treatment over time. HbA1c is also used to diagnose diabetes. While HbA1c is an important tool, it should be used in conjunction with other aspects of diabetes management, including monitoring blood glucose levels regularly,